I'm excited to actually present this lecture to you. I know that this is definitely a very controversial lecture. This is a lecture that many people have different opinions on, but I hope that what we can do tonight is to present some information that you guys can use to be able to make some good decisions concerning a very a big topic, one that I'm glad that we're discussing, and that's dietary supplements. And so just by show of hands, how many people use supplements in some form or fashion? In anybody? Yep. All right, good. Okay. Yeah. So it's not uncommon. In fact, whenever we look at when we look at what a supplement is, right? This is the basic definition of a supplement. It is some kind of product that you take in a small capsule, gel, liquid product, something that contains either vitamins, minerals, an herb or botanical ingredient, amino acids, enzymes, even organ tissue. This is not uncommon. Just because they are delivering different, they're purported as delivering different nutrients in very concentrated amounts in a very small space. Just in general, over 50% of the population uses supplements in some form or fashion, and the most common one is actually multivitamins. Interestingly, the largest use of multivitamins is not actually in our older population, as it may have been several years ago, but actually in the population ages 18 to 30, 18 to 25, 18 to 30. And the most common reasons that people state for using supplements is either overall health and wellness or to fill nutritional gaps. So I don't know if any of you fall into that category. Some people do, some people don't. There are other reasons for which people many of you may be or may not be taking them. Understand, so back when this presentation was updated a few years ago, they'd mentioned that supplements were actually a $13 billion a year industry. In 2020, though, the US population actually spent $140.36 billion in supplements. It is a huge industry, and it is expected to actually be significantly increased this year. Last year with COVID, we noticed that actually this went up quite a bit. The average American spends about almost $55, $60 a month in supplements. And is this really a good use of our resources? That's what we want to talk about. There are a couple of things that we want to know just legally. As you know, that medications in general are regulated in the US by the FDA. Supplements, on the other hand, are a little bit different. They're not regulated by an independent body. So there's not someone who is specifically looking over and saying, hey, every supplement that comes into the market, hey, are you is the purity okay? Is testing specifically required? Mainly because they're considered to be a natural product, natural occurring product in some form or fashion. So this is one of the reasons. There's multiple other reasons for it. I'm not going to get into the politics of it, but understand that the reality is that testing is not required. There are no dosage guidelines for these. Some of the things that we do find, if there are physicians who use supplements in a wise form or fashion for acute settings. There are some guidelines for certain supplements that have been studied in certain populations at certain doses. But again, for the wide majority of them, they don't. This is not the case. It is not uncommon, in fact, for many of the supplements, especially for the food supplements that are out there for them to be contaminated with lead. This has actually been an ongoing thing for a long period of time, trying to make sure and ensure that people, that this is regulated in some way. People have been fighting to make sure that this has been regulated. And unfortunately, it's difficult, again, without a standard body looking at this, to be able to say for sure, yes, what you are getting is just what you're getting and what it says that you're getting on the bottle. And again, as I mentioned, it's sold without FDA supervision, as most medications are. Do you need a dietary supplement? We just want to look at a couple of things. Remember that one of the main reasons that people say that they use it is for overall health and maintenance. And many of the common things, men, for example, said that the main reason that they use supplements is to lower cholesterol. Women, it was using calcium to be able to help with bone disease. So there are many different reasons, but those are some of the common ones. One of the most common, obviously many of the most common diseases that people are going to die of in the United States are cardiovascular disease and cancer. And so one of the things they wanted to look at was actually looking at vitamins, minerals, and multivitamins, and what the effects are in these specific areas. Okay, so this is again looking at much data, and this is the very specific thing that they're wanting to look at is for people who are getting adequate nutrition. We're not talking about patients who are malnutrition. We're not talking about people who have GI disturbances that don't allow them to adequately absorb nutrients. We're talking about the general population that can get adequate nutrition orally, okay? And specifically looking at cardiovascular disease and cancer. They looked at over 12,000. So basically, you're looking at over 12,000 articles, abstracts, and studies as they are. And the studies that they looked at, they wanted to make sure they're good quality studies, right? You don't want to look at studies that are flawed or that are biased in one direction or the other. The studies that they came up with. The sizes ranged anywhere from 128 up to 72,000 people in the studies. The age ranges that they looked at were people in the ages of 22 to 77. So we're not talking about children. We're not talking about the really elderly. This is the age group of what most of us represent here. The follow-up was over 6 months, anywhere from 6 months to 16 years. Most of them were usually less than 10 years. Let's look at a couple of these most used vitamins supplements. One of those is multivitamin, right? So we talked about that being the highest number that was used. There was what they noticed with the outcomes, and this is that there was a very slight protection when it came to cancer from men, but only in one study and none when we looked at women in general. And there was no improved effect when it came to heart disease. All right. When we look at beta carotene, right, this has actually been something that has been increasing over the last few years, the use of beta carotene, not just in multivitamin, but specifically own. There was no effect on mortality, heart disease, or cancer. And actually, something that you want to keep in mind is that there was actually an increased risk of lung cancer in smokers and especially those who smoked and had exposure to asbestos. I want you to keep this in mind when we look at another thing, specifically looking at beta carotene, right? Vitamin E, again, they didn't find any effect on mortality. Now, again, this means deleterious or otherwise, no effect on mortality, heart disease, or cancer. Selenium, vitamin A, selenium's same thing, except there was an increased risk again in lung cancer, especially in smokers. You'll find the same thing for vitamin A also, an increased risk of lung cancer. So again, you're not necessarily seeing any improvement in most of these. And those with the multivitamin group, the slight protection, again, usually in the men were those who were nutritionally, who had slight nutritional decreases too. We'll look at vitamin C. This is another one that is actually used very frequently in cancer. Especially most recently, you'll see people utilizing IV vitamin C. Again, when they looked at these studies, these are again studies that are comparing vitamin C to and outcomes to other things, oftentimes placebo. And there was again no effect on mortality, heart disease, or cancer. Same thing when you look at folic acid. But again, here we see the only effect that you do see is an increased risk of prostate cancer. When it comes to vitamin D, calcium, again, you're not seeing improvements as far as, or changes as far as effect on mortality, heart disease, or cancer. When they are combined together, there's a mixed results on cancer. And actually, there was an increased risk in cancer, in certain cancers, with a combination of vitamin D and calcium. So that's why they mentioned mixed results on as far as cancer is concerned. Why is it again that that this is important? We don't find in these specific diseases, and these are the things that are going to take us the most here in the US, we don't find a beneficial effect of these specific supplements. And again, we're not talking about all supplements, and I'll change that caveat with you in just a second and tell you exactly what I'm meaning on that. But those, the ones that we just listed, these are the most commonly used ones. Again, the ones that we just reviewed above. There was no improvement when it came to heart disease, to cancer, and mortality. And specifically again, and this was in individuals without deficiencies. Okay, so keep that in mind. So those who already have adequate amounts of these vitamins. I want you to look at something else. So we just talked about lung cancer, right? And we talked about beta carotene and how there was, when someone supplemented beta carotene, they actually increased the risk of lung cancer, right? There was an increase in the risk of lung cancer. Now look at this. These are, we recognize that smoking is one of the biggest risk factors in lung cancer, but understand that alcohol, when we talk about drinking, it's not drinking water, it's drinking alcohol. Alcohol consumption, we know, increases many different cancers, especially one of the fastest rising cancers that would be breast cancer most recently. Smoking, drinking, and increasing meat intake has an increase in the risk of many of these cancers. Now, when you're looking at this graph, what I want you to understand is the baseline here are for those, the risk of lung cancer are those who eat, who have certain lifestyle habits that are going to predispose them to cancer, and then not taking any green and yellow vegetables on a daily basis. Okay, that's the baseline. If you took people who did those same lifestyle habits that we talked about, smoking, drinking, meat intake, and then you had them add in a daily intake of green and yellow vegetables, look at the risk reduction rate. The reduction in mortality was actually, sorry, not risk reduction, the reduction in mortality was actually 30%. 30% just by adding your green and yellow vegetables. When you took a person and you took out all of those other risk factors, the things that were predisposing them to the cancer, and then you also had the additional green and yellow vegetables added in on a daily basis, look at that reduction in mortality. I mean, it is significant reduction in mortality, up to 90% reduction in mortality. And here's the interesting thing. They believe that the antioxidant properties from beta carotene are what are contributing to this. But remember what we said, when we're increasing and taking supplements, very concentrated amounts of beta carotene, we're not seeing that same effect. And actually what we're seeing is actually an increase in the risk of lung cancer and mortality from it. So I just want you to understand that what you're getting in a pill is not the same thing, or in concentrated, let me just use less volatile language. What you're getting in concentrated amounts of isolated nutrients is not the same thing as what you get in your daily intake of food. Okay, food is more important than these than what you are than what you take by the supplements. And could someone, I apologize, I did not start my timer. If someone could just send me a quick chat, just tell me how much time or I have left. Anybody, can you, someone just shoot me, or just if you'll just say it out loud, it's okay too, just so I know. I apologize. Anyone quickly want to tell me? No, anybody? All right, somebody, 5 minutes, 10 minutes, what do I have? Anyone?
10 minutes.
10 minutes.
Okay, thank you. All right, so when we're looking at, all right, let me just put that on here so I don't have to ask you guys again. I'm so sorry. All right, okay. When we're looking at nutrients in combination with medications, this is something that is very important. There are a large number of people who are taking medications and then taking supplements on top of those medications to improve certain factors. One of those things is cholesterol. The most commonly used medication to treat cholesterol is our statins. When we look at statins, we recognize that there is actually reversal in heart disease associated in the plaque when people use statin medications, and it is certain subpopulations, but there is reversal. When those same populations add niacin to the statin, there's actually less of the reversal, so the benefit is actually less. If that statin is added to other supplements, there's actually progression of the coronary arteriosclerosis, so that plaque formation, and then placebo. Of course, there's also increase in progression. What does this mean? The reason we just want to bring this up is understand that these supplements, even though they are naturally found in our foods, they are not, when used in concentrated amounts, they are not they're not benign. They are going to interact with our medications, and we have to be careful in how you use them and to let your physician know if you are using any of these supplements. And again, our recommendation is going to be different than using these foods, and we'll show you again why. Let's look at a couple of things. One thing to me actually that was very important is something I found when I started doing lifestyle medicine. This is back in 2012 when I started doing lifestyle medicine. One of the things that I found is that there was a significant behavior change in patients who took supplements versus those who did not. And again, I'm gonna tell you, this is specifically patients who already had chronic disease. Again, patients who already had chronic disease and those who took supplements. Let's look at something. This is specifically actually just looking at those who are taking statins, any kind of medication, specifically to be able to decrease cholesterol, and then I'll show you what I'll tell you what I found just with my own patients who are using supplements. This is the NHANES study. We've brought this up several times throughout our lectures. Large, huge number of people that were followed again from 1999 to 2010. Large, a very wide population of people. Now, what I want you to look on this chart is the dark blue are those who are using the statin, using the medication, and the light blue are those who are not using the medication. Okay, in this, we're specifically looking at the changes in their calories when they start using the statin. It is not uncommon, and in fact, very common, and I've seen this again in my patients, that when starting medications that decrease certain things that come as a risk, of lifestyle, people change their lifestyle, but interestingly, not for the better. What you're seeing here is that as people took statins, the overall trend was to actually increase in the number of calories, versus those who did not take statins to lower cholesterol, they actually were less likely to take they're more likely to actually change their caloric intake and decrease their caloric intake. Look at this when it comes to fat intake, okay? When it comes to fat intake, again, this is those who are taking the medication. These are the light blue is those who are not taking the statin medication. Over time, a person is more likely to actually increase their fat intake when they're taking a medication that they believe is going to help decrease their cholesterol. And then, but those who are not taking the medication, they're more likely to decrease their fat intake, change their lifestyle for the better rather than for the worse. um, why does this make a difference? I again want to emphasize this because I find the same thing in my patients who are taking supplements specifically to treat chronic diseases, that very often the push that they have concerning lifestyle actually goes down, not improves when they're taking it. Rather than using it as a short-term supplement maybe to help, they're actually using it as almost in the same way that many people use medications. When I want just to look also at a couple of other studies looking at vitamin E. Remember, we talked about the increased risk of prostate cancer. This is a very large study, NIH, the AARP. These are older, significantly older population, men ages 50 to 71. They were at the beginning, they were cancer-free, followed for 5 years. And you had among this population of about 300,000 people, you had 10,000 cases of prostate cancer that developed. Now let's look at the studies themselves. These are the participants, and this is the amount of vitamin E that was in there. And this was the amount of vitamin E that they took nutritionally, plus what they took supplements from the supplements. Nutritionally meaning from their food versus supplements. One of the things that is important to understand is as they increase the vitamin E dosage that they were taking daily, they also increase their vitamin C and their beta carotene, not so much their selenium dosage. And then average age are the same in this. One of the interesting things that you see here is there wasn't really any improvement in preventing prostate cancer when someone added vitamin E. Again, this is one of the vitamins that is touted very prominently in patients who have in men to be able to prevent prostate cancer. But they did find something that was very unique, and I want you to look at this. Gamma tocopherol, which is one I guess breakdown or product when you're looking at vitamin E. When people took it by dietary, meaning by the food that they ate, there was actually a risk reduction in the amounts if they had increased amounts of vitamin E via their food versus taking it by the supplement. But remember, you did not actually see you did not see any improvement when you were taking it by supplement. You're like, why? What does this mean? Again, what I want you to understand, and I'm going to show it to you in another slide. I've got just a few minutes. As to there are very unique interactions of these foods when taken in our body, and the way that they are used in our body in interaction with other factors with our immune system. It is not the same when we take it in a supplement form versus when we take it in a food form. Vitamin E rich foods, for those who are wondering, includes sunflower seeds, almonds, hazelnuts, so our nuts and seeds, avocado are good fats, okay? It also includes avocados, kiwis, and mangoes for good amounts of vitamin E. And again, when you're looking at this, the protection from vitamin E as a supplement is not there versus when you compare it to the consumption of gamma tocopherol in your foods, okay? then you actually have a reduction in the risk of actually having clinically relevant disease. I want to just show you an example of something that I want to talk about. Why is it that we may not see these differences? Many people, one of the most common supplements that people actually took were omega-3 fatty acids. And it is commonly told by physicians that people are not getting adequate amounts of the not the not so there's a precursor. The ALA is what you will get in your foods, okay, and then your body has to convert this to the other forms of the omega-3 fatty acids. And so people supplement because they are told that they're not able to get more. Here's the interesting thing I want you to understand. This enzyme that actually helps in the conversion of the the one that we actually get in foods, ALA, both we and animals, fish, have to get it from our food, and then both they, fish, and we convert it. This actually is inhibited by certain things. There are 4 things we know that inhibit that conversion process to the other ones. Interestingly, people who are on a completely plant-based diet had adequate amounts, when measured, had adequate amounts of the other omega-3 fatty acids downstream. Why is that? Because they actually had less intake of saturated fat. So things that inhibited these enzymes in the conversion included saturated fat intake, trans fat intake, alcohol, and caffeine intake. These why so often many of us are not getting the benefits, and why we are having to supplement is because there are lifestyle choices that we are making, all lifestyle things that we have talked to you about in these previous presentations, that are preventing us from being able to get the full benefit from our food. And so then people oftentimes will that when we supplement, we actually will interfere with these pathways in the body. Okay, these pathways don't work on their own, they interact with each other. When you and I take supplements, we interfere with the pathway and then with everything else that interacts with these pathways in our body, preventing the actual natural processes that we have in our body to be able to produce these vitamins and use them in an effective way. If any of you have, in the last 20 seconds that I have, and if any of you have listened to my to one of the talks that I did with when we were exercising, we were talking about melatonin. Melatonin is one of the most potent oncostatic cancer fighting agents in our body, and people will take this in a supplemental form thinking that they're going to get the same benefits. While it does show some benefit for sleep, it actually doesn't show the long-term benefits for sleep, and actually has an effect at which it just plateaus and doesn't improve anymore after that. The interesting thing is this: if a person supplements melatonin, while they may just get this plateauing effect, what they will do is it will inhibit the pineal gland from proper production, and then pushing out of the melatonin in our body. Why does this matter? That melatonin is pulsed out from our pineal gland in a very rhythmic like fashion, and interacting with so many other hormones in our body. When we take a supplement outside and that does not have that same pulsatile motion, we inhibit our own body's process of being able to make that melatonin. But then the second thing that we do is that we inhibit that concert action and that pulsatile motion of the melatonin and the way it's produced. We cannot, even with slow release melatonin, cannot mimic that pulsing motion that happens in our pineal gland. And how do you get that pineal gland to do what it does? It's by making sure that you have adequate carbohydrate, whole food carbohydrate intake, and exposure to sunlight in the morning, and then having dark at night. So again, each of these things, our bodies can do these things if we take the adequate food that we need, but oftentimes the supplements that we do inhibit the ability for us to do what we need to do. My encouragement to each of us is, I have seen and I have treated patients ever since 2012, as I've taken care of my patients doing lifestyle medicine. Many of them cannot afford to take many of these supplements, and we're going bankrupt using supplements. They implemented lifestyle. You guys heard of Bill, who I talked about at the one of the beginning, or one of the earlier lectures. Simply by lifestyle, eating the foods that were out there. He was able to reverse disease. And again, you can do the same thing without the added amounts. Again, for those who are nutritionally deficient, there are a couple of things to keep in mind. Dr. Abraham talked about vitamin B12. And then he also, being able to supplement vitamin B12 in our foods for those who are going completely plant-based. And for those who are indoors a lot, vitamin D supplementation only to bring you up to normal levels, not in addition, helps. Many people have been emailing me this week or talking to me about, oh, well, what about vitamin D and COVID? Well, understand again, the benefits for those who are taking it in regular small doses, not in high pulse and push doses, but in regular small doses on a regular basis. And again, the as far as the benefits, the studies don't show the full scope of the benefit that many people have purported. Again, lifestyle had more of an effect than those who were taking supplements, even when it came to vitamin D. Final conclusion again, Hippocrates, let your food be your medicine and your medicine be your food. Okay. One of my favorite quotes: in grains, fruits, vegetables, and nuts are to be found all the food elements that we need. If we will come to the Lord in simplicity of mind, he'll teach us how to be able to prepare that wholesome food. And Rachel is helping us do many of those things. Remember, use a variety of grains, vegetables, fruits, and legumes. Use whole grains daily, every single day. Make sure that you're getting those 3 to 4 servings of vegetables, and make sure that in those daily servings are included dark green leafy vegetables, or dark green vegetables including dark green leafy vegetables, and then 3 servings of fruit including the orange